How do social determinants of health affect rural communities? Have you ever wondered why health outcomes can vary so much between urban and rural areas? The answer lies in social determinants of health. These factors shape the conditions where people are born, live, learn, work, and age, significantly influencing their health and quality of life. In rural communities, these determinants often create unique challenges that can lead to poorer health outcomes. Rural residents frequently face higher poverty rates and lower income levels. This financial strain limits their ability to afford health care, nutritious food, and safe housing. When people cannot access these essentials, their overall health suffers. Additionally, educational attainment and health literacy tend to be lower in rural areas. This lack of knowledge can reduce awareness of health risks and limit access to health-promoting resources. Infrastructure issues also play a significant role. Many rural areas struggle with limited broadband internet access and transportation options. For instance, fewer public transportation choices and longer distances to healthcare facilities can hinder timely medical care. This is especially true for specialized services like mental health care, maternal health, and trauma care, which may not be readily available. Environmental factors further complicate the health landscape in rural communities. Issues like water quality, air pollution, and housing safety can pose serious health risks. For example, lead-based paint or inadequate weatherization in homes can lead to health problems for residents. From a liberal viewpoint, addressing these social determinants is vital for achieving health equity. It is essential to understand that rural health disparities are not just individual issues but are rooted in broader social and economic inequalities. Policies should focus on increasing investment in rural infrastructure, expanding access to education and health care, and improving transportation options. Ensuring affordable housing and access to nutritious food is also key. Practical steps include expanding Medicaid and other public health programs to cover more rural residents. Increasing funding for rural health clinics and telehealth services can help bridge the gap in healthcare access. Supporting education initiatives that improve health literacy is also important. Enhancing broadband access enables telemedicine, which can help mitigate the shortage of specialists in rural areas. Additionally, integrating social services with healthcare can address various barriers that rural residents face. In summary, social determinants of health significantly affect rural communities by creating barriers to essential resources for good health. A liberal approach focuses on systemic change and public investment to reduce these disparities and improve health outcomes for rural populations.